how physicians can get started on remote patient monitoring on this week's Medical Economics Pulse.
We have found that the virtual office staff and taking that burden of the AWV, of the remote monitoring from the clinical staff and putting it, I have a separate location for the staff now. And it has grown to the fact that this staff is not only doing remote monitoring in AWVs, they're looking at our HCC scoring, they're auditing charts, they're doing quality, they're helping us close gaps. We're doing behavioral health assessments, possibly over the phone before the patient comes in. This virtual office, I think, will generate as much revenue as a clinical office eventually.
The COVID-19 pandemic has made it necessary for physicians to provide care outside of the normal office visit. Some physicians have become pioneers in virtual care, such as telehealth and remote patient monitoring. One of them is Dr. Jon Regis. Regis is the president of Reliance Medical Group in New Jersey. His practice has taken telehealth and remote monitoring to the next level, creating a virtual office that treats hundreds of patients per day, entirely via technology. Regis is my guest today on Medical Economics Pulse. We talked about how he came up with this virtual office concept and the benefits to patient care and revenue, and why he thinks it's a model that can be used to save primary care. Dr. Jon Regis, thank you so much for joining us today.
Thank you, no problem.
So the first question is remote patient monitoring. What is it? It's one of these things where everyone's heard the term, but what exactly does it mean?
Well, what it means to me in our organization is a way to, and I don't want to say monitor, a way to better engage the patient, engage the patient to monitor some biometric data or physiologic data, using either technology outside of the traditional medical office. It could be in the patient's home or wherever the patient may be. So that I think the key is being able to monitor the patient, give the patient better access, get the patient better engaged using technology, whatever that, I call them gizmos sometimes, could be, to make sure that we're in better contact.
Okay, can you talk a little bit about how the pandemic has changed the way that you use remote patient monitoring, and how has it sort of enabled you to grow what you're doing with RPM?
Well, it's interesting because the pandemic, I think, forced the country in various sectors into uncharted territory. And I think that the changes you're going to see in healthcare are going to last forever, I think. And some of the changes, I think, are going to be good. I think that the remote monitoring and telemedicine grew out of the fact that patients, of course, were uncomfortable coming into the office to see their physician. And we needed to make sure that we were engaged and in contact with our patients. And so out of that grew the concept, which was already there, by the way, of how can we monitor some of the disease processes at the patient's home or wherever, where the patient wouldn't have to come into our office. And I think what happened was the pandemic people keep talking about the hospitality industry, but it has devastated the primary care industry. In fact, I'm concerned that in certain areas of the country, you're going to have primary care docs who really might go out of business or be forced to not remain independent any longer. And sometimes the option was going to be employed by the hospital, and the hospitals are having such problems. That option may go away. So I'm afraid you might have primary care docs actually going out of business. Let me just comment one thing. It's interesting that I'm part of a committee that's trying to save primary care. We've had some testimony with the subcommittee on primary care in Congress, and I was on the phone or on a Zoom or whatever it was, And I was listening to some physicians in Alabama and Mississippi, and I'm sure there's other kind of more rural areas, and they didn't even have the internet wasn't even, they couldn't even do telehealth. So there was a 5-man physician group that had gone through their savings, gone through their 401k, and they were actually working for free, and they had 30,000 patients, and they were getting ready to close the door. Now, that to me is a medical emergency. What do you do to help those docs, to help them keep in business when the patients can't come in, the internet's not they said is sometimes it's not even working. So, but that leads us down a different path. But I think for us the docs that have access to adequate internet speed, the concept of being able to monitor our patients, especially those of multiple comorbidities, from their home, I think that technology is here and it's just going to grow. And I suspect we'll be able to monitor other conditions over the next 5 to 10 years. In fact, I think the whole concept of the medical office is going to change, really.
I definitely want to get into that way the concept of the medical office changing. But first, I would like to just kind of get into a little details on how you're actually using remote patient monitoring. Give me some examples of how you've treated some patients using it, or how you kind of supplement their care with remote patient monitoring, especially with these folks you're talking about with chronic conditions.
Now we do it a little differently. We have partnered with a company called RPM Connect, Division of CareMinder, and we did 2 things. First, Reliance Medical Group is a multi-specialty primary care group. We have about 21 offices. We have about 70,000 individual patients. And I always wanted to be able to be in contact with all my patients. So we developed an app that could go on an iPhone or whatever. And I wanted every one of our patients to have access to that app, to push information, appointments, that kind of thing. Well, from out of that concept, we said, well, look, if I have all my patients on my app, maybe I can use the app as the connectivity piece between my patient and my virtual office staff, which I'll get into a little bit later, to make sure that I'm keeping contact and can notify patients if they go off the guardrails. So what we did was we looked at hypertension and diabetes, it was very easy to pull those patients up from our EMR. You put in certain codes. I can get a list of every hypertension and diabetes, which we had about 6,000 or 7,000. Okay. But let me back up a little bit, because how this whole remote monitoring thing and app started was it came out of the concept of the annual wellness visit. Mm-hmm. I'm sure you're familiar with.
Yes.
Well, before the pandemic actually even hit, we were having difficulty getting our patients in to get their annual wellness visit done. And then we were relying on our regular office staff to schedule and call, and amongst the other 1,000 things they were doing to try to make that happen. So I decided to make an investment. I said, I'm going to hire a person whose primary responsibility is to call patients and to get them to come in for their annual wellness visit. Because all the payers and all the insurance companies want to have that visit done. Well, we went from doing, when we hired this person, we were doing maybe 12, 13, 14 a week. We went up to doing 60 to 70 a week. So wow. I said, that ROI, return on investment, it made a lot of sense. But what came out of this was the idea that, I can't put this burden on my office while they're sitting there making appointments, talking to a patient right in front of them, preparing the patient in the clinical setting. So we decided to develop a concept called the virtual medical office. And we hired that one young lady. I'm now up to 12. And what they do is a number of things. First of all, they're responsible for working with our partner, putting the patients on the app. If they have high blood pressure, hypertension, or diabetes, we're calling these patients, we're onloading them onto the app. We actually give them a Reliance logo blood pressure machine, and a glucometer, and we call it our red bag. The red bag is synonymous with, actually it is a red bag with Reliance logo. And we have the patients come in, or we meet them, and they get their blood pressure cuff, information about their particular, about hypertension, let's use hypertension for example. And they have to know that this red bag is part of their prescription. You're no longer going to be able to come in here and just get a script and go home. You're going to have to participate in your care. And we keep hitting them with that, giving them the app, giving them the blood pressure cuff. And then we have gotten to the point where Mrs. Smith, I'm being monitored by certain payers as to the quality that I give you. Mm-hmm. And for me to get monitored properly, you've got to give back to me. And if you're not willing to do that, you may not be able to stay a patient with me at mine any longer. And we're getting to that point with some patients. Mm-hmm. Because you have to participate in your own care, or you can't participate in my practice. So anyway, from that concept, we started hiring staff. We developed the app. The patient, depending on what journey they're in, they're inputting the data into the app that goes to our monitoring center. We have a list of standards from the American Society of Cardiology, American ADA, of what the guardrails are. And when patients fall off the guardrails, they get red lighted, and our staff calls them. If they lack a sign-in, say they're supposed to check in every 3 or 4 days, and they don't check in, that we have a concept we developed with the RPM Connect, what they call the reviewer, that we can see what patients are falling off the journey. They're not following the guidelines, and then we call them to get them back on the natural course, so we can monitor them. We have found that the virtual office staff, and taking that burden of the AWV, of the remote monitoring from the clinical staff, and putting it, I have a separate location for the staff now. And it has grown to the fact that this staff is not only doing remote monitoring in AWVs, they're looking at our HCC scoring, they're auditing charts, they're doing quality, they're helping us close gaps. We're doing behavioral health assessments, possibly over the phone before the patient comes in. This virtual office, I think, will generate as much revenue as the clinical office eventually.
That actually, I wanted to ask you about that. Like, that's an extremely impressive setup that you've got there. And I think it's really fascinating. We were just talking about like survival of primary care practice.
There you go.
And this seems like a way to do that. Why, this obviously predated the pandemic. Yeah. What made you think of this? Why did you decide to do this, to embark on this journey with your practice?
Well, as I said before, the idea came up from the annual wellness visit. I knew that there was, first of all, the annual wellness visit is the gateway to taking care of patients for the rest of the year. They're going through the different, it's a way to start them to engage into the healthcare system. And every payer you should have a physical every year. And of course, CMS pushes this tremendously. So I said, I know I have 5,000 or 6,000 Medicare patients. How come I'm only, and this is supposed to be done once a year, how come I'm only doing 6 or 7 AWVs a week? And I'm saying, and I'm constantly harping to my office staff, are you calling these patients in? And out of the 1,000 other things they're doing, I said, let me hire one person and see if that makes a difference. And lo and behold, from that investment, I said, well, let's look at some other revenue opportunities that also help us engage our patients better and take better care of our patients, which is the bottom line, really. Yeah. So I said, let's look at our diabetic and hypertensive patients. They're very easy to pull up from the EMR. We started looking with our partner, RPM Connect and Care Monitor, and said, look, we're gonna develop the concept. We're gonna order the gizmos. We're gonna develop the red bag concept. And now I see this red bag all over town. People use it as a shopping bag. I mean, it literally is a red bag that has Reliance's name on it. And,
It's a little marketing too at the same time.
yeah, come on now.
Oh yeah.
There's a method to the madness. So, and then we started getting success. I think now we have close to 1,000 patients that we're monitoring. And by the way, my goal is to have 2,000 of our diabetic and hypertensive patients on the journeys. We're working out the bugs. We know the codes pay. We ran into some issues, making sure every office runs into the same issue: verification issues. Are they still insured? Copay and deductibles. All that stuff that you normally see in the office, you see in the virtual office. Mm-hmm. But we've taken the burden of that off the clinical staff into our virtual office, and they deal with that offsite with the remote monitoring. And by the way, and I hate to create silos, but we've actually divided the virtual office staff. We have 3 or 4 employees who are doing quality and training. So they're going out and looking at making sure we're closing our quality metric gaps. They're going out meeting with our staff in the clinical offices to make sure that they understand what they should be doing. They're looking at our HCC scoring to make sure that that's being updated and being done properly. Then I have another division of the virtual offices doing the remote monitoring. They're looking at the diabetic journey, the COVID journey, the high blood pressure journey. And then we just added the behavioral health assessment that can be done over the phone that's reimbursable. And my goal is to have everybody over 18, which I think it might be a quality metrics for certain payer, to have a behavioral health assessment done at least once a year. Well, if I can get that done through an app over the phone, even before you come into your visit, so when you come to your visit, the behavioral health assessment that you could do is done. I mean, do you see the multiplier effect here? Oh, yeah. Not better patient care, but also generating additional revenue. And
I want to ask you a little bit about, for other physicians who are watching this, how should they get started on their own journeys in terms of using some of these virtual care and remote patient monitoring technologies to help them treat their patients? What advice would you give them on where to start?
I would start small. I would first of all, I would make a recommendation for RPM Connect and CareMinder, but there are other companies out there. But I think my partners work with us. We've worked out some of the kinks and the reporting. This reviewer program that lets us know when a patient is not checking in. We every day we get a report say, hey, this lady, she didn't check it in, but she didn't. So we're able to call them. I think you start small. I think that first of all, you find a partner, a technology partner that can work with you. And then sometimes you have to make the investment. If you're large enough to do that, or you cut out some time from your existing staff, or they may start with 100 patients. 100 patients may generate $16,000 or $17,000 a month. Literally, if they're remote monitoring, if training them how to putting the patient onto the device and instructing them, that's 2 codes. And then 20 minutes monitor, it's somewhere around 140, 150 bucks a month. You bill it once a month, and then you're monitoring another 50 or 60 bucks depending on the payer every month. Well, the numbers add up. We did an in-depth analysis of revenue potential from our practice. If we put 2,000 patients on remote monitoring, it generates $4 million in revenue. This is new revenue, okay? And it's not revenue that I have to depend upon Congress to pass a stimulus package. It's revenue that's already there.
Yeah.
It's already in the pipeline. So I'm tapping into codes that already exist. So I think, look, healthcare is a business. It's a very special business. We deal with patients' lives, but it is a business. And nobody wants to work for free. I'm trying to use the tools that are there to make sure I can pay my staff and providers commensurate with what they're doing. And for primary care, we've always been on the low end of the totem pole. Our margins have always been very small. So I'm saying, look, we got to revolutionize this thing. And the pandemic, actually, I think it's going to hasten this up and look at other ways that we can engage our patients, generate additional revenue. And by the way, at the end of the day, actually reduce cost in the whole system. Because we've already shown that we prevented several hospitalizations from monitoring these patients from home. They were able to catch them, get them into the office, or get this, we call the patient, hey, your blood pressure is a little high. What are you doing? By the way, would you like to talk to the physician right now? We're actually thinking about having a nurse practitioner in the virtual office full time for telehealth. That generates additional revenue.
Yeah.
And it's taking better care of the patient. So
have you run into any challenges with your various payers in terms of getting paid for any of this?
Let me say, first of all, we have some payer partners in the state that are working with us on this, on the concept. We know that every payer in New Jersey pays remote monitoring codes, but you have the same snafus that you have in any multi-payer system.
Yeah.
Sometimes they pay, sometimes they don't pay. Sometimes it's inappropriate denials. You just got to go through the process you normally do. And one of the things that we're trying to do that we think could be revolutionary is that we're working with some financing opportunities where we may be able to bundle these codes and revenue and get paid in advance as we move forward. And now, if we can pull that off, that changes the ball game completely. Not so much factoring companies, but companies that are willing to work with us. Maybe even some banks that we've known that says, you know what, I'm looking at your revenue stream. I'm willing to upfront you some of this money, and I'm going to get my piece. Everybody's got to get paid. But to me to get the money quicker may be worthwhile to give up some of the money. If you get what I'm saying.
Yeah.
Now we're just starting to work on that, but that is a real opportunity. But you're going to have the same snafus. One while we were going through the process. Let me tell you one of the first things we found out. We started doing this, and then we found out our virtual team wasn't checking eligibility. So we always do it in the office. So our virtual teams, we started looking at our denials and doing our denial analysis. Oh, why are we being denied? Well, the virtual office staff, they were so aggressive in onboarding the patients, they weren't checking eligibility to see the patient still had insurance. So we quickly solved that problem. And then we have the problem of payers. They'll just deny you, but you know this. I mean,
it's like anything else. Yeah.
Like anything else. You just got to be on it. And
I mean, it sounds like what you're saying is like, as long as you have good developed processes for checking on these things and sort of the roadmap of working with your payers, remote monitoring is different codes and a different program, but you check on it the same way you check on anything else.
And the first thing is to find out that all our major payers are paying for this code, and it's pretty consistent. So it wasn't that one of our major payers, Blue Cross Blue Shield, I'm not going to pay the remote monitoring codes. Nah,
yeah.
they're paying for these codes. You just have to make sure how to maximize it and how to go after your revenue like you do in your regular practice.
Okay, can you talk a little bit about using the technology? Because obviously some patients are really good with technology, and I'm talking about like the devices in the red bag you were mentioning. What do you do in terms of educating patients on how to use that? I imagine it's pretty intuitive, but I'm curious about how you actually kind of get them on board using it properly.
Well, by the way, it's a great question because it is problematic sometimes, especially with some of our elderly patients. Sometimes we have to have the caregiver be part of the onboarding process, and sometimes you just can't put them on the journey.
Yeah.
But that percentage is minuscule. I think that then we had a problem of for some of our patients that they're in urban areas that maybe disadvantaged, which we have a lot. Do they all have a phone? But most people nowadays have a phone. Yeah. That's not an issue. Now, whether they're willing to give up minutes or put on the app, then we're working on a program now where, you know what, The revenue is to the point where I'm willing to give you a phone. And you know what? Caveat. You can use that phone. You can make calls, whatever you want to do. But the moment you miss two of your finance and check-ins, that phone shuts off. You got to call. We're monitoring you that, so that phone becomes useless. The incentive ball games and gamification and the reward mechanism, we're also looking at that in terms of our monitoring program. Is there some way we can gamify our monitoring system? So we have star system. If you sign in 2 or 3 times a month and you sign in every time for 6 months, you get a $50 gift card to CVS or whatever. We're looking at different incentives to keep people engaged because it saves money in the long term.
Let's talk about, you had mentioned before sort of primary care of the future and the role that what we've been talking about is in building that practice. What do you envision as a good primary care practice in the future? What should it look like? And also just as important in terms of the patient care is how can we make sure these practices survive? Because as you were saying at the beginning, practices are suffering across the country because of COVID and the economic downturn and all that stuff. How can we sort of connect these dots in terms of using this technology and helping keep these practices afloat?
Let me tell you something. When you have 160 employees and 40 providers, when my revenue dropped 60%, I would say this, the PPE program, Paycheck Protection Program was a lifesaver for us. In fact, I became an expert on anything that had money attached to it related to the pandemic. I actually was advising other docs, and we were pretty successful. I think going into the future, that remote monitoring is just going to grow. I think there's going to be more gizmos developed so we can monitor the patient from home. I think that there's going to be more codes developed, and I think the payers are going to start paying more for those codes. And I think remote monitoring, especially in the value-based risk world, where we have more contact with our patients. You know, it's very interesting. We found in our population base that was over 65, they like the fact that they got a phone call. That somebody was, oh, you know what, honey, I forgot to take my blood pressure yesterday. And that engagement, I think, is key to any successful management of, well, no matter what the problem is, you've got to get the patient engaged, because the patient's not engaged, the outcomes that you want aren't there. So anything that increases patient engagement, while I also get paid for it, it's the holy grail.
Yeah, it's interesting what you just said about the patients enjoying that interaction. And I think, you know, one of the things we hear about from doctors all the time is how the patient-physician relationship has sort of frayed as care becomes more transactional. But what it sounds like is that you're using this technology to actually build stronger relationships with your patients.
You know, it's interesting because I have multiple offices, and a lot of the office staff, they know their patients. And this is how come I wanted to brand Reliance. I wanted every patient to have my logo, my app on their phone. They can tap into that thing and ask a question. They can tap in that thing and request a telehealth visit. They can get pushed up. The office is closed because of snow. Is it time for your flu shot? Is your kids going to get, is their vaccination delayed? Keeping them engaged means we taking better care of our patients. And in the long run, I think it's going to increase quality and reduce the cost.
Is there anything else about this topic that you think it's important for physicians to know about as they sort of embark on their own journeys with this technology?
I would say don't start small again. Don't get discouraged. Make sure you do the financial analysis of if you start off with 100 patients. First of all, become very familiar with what remote monitoring and other avenues of revenue are out there besides that patient visit in your office. You'd be surprised. Once you add up a hypertensive patient that needs an annual wellness visit, that needs a behavioral health assessment, you find out that visit now, or that patient now is generating $500 a month. you'd be surprised. Now you have to have the staff that's digging for it, but it's there. One of the things that we're looking at is whether I can make the virtual office scalable. So maybe I can have I've already got other docs in my community that want to buy into the service. And so we're going to make a business out of this. I just got to make sure that Reliance at our site, we've worked out all the kinks. We've got all, because I'm not selling a pig at a poke. I want to make sure that when a physician buys into it, that they're recognizing revenue within 30 to 40 days. They're seeing resource revenue. And that's what we're going to do.
Dr. Jon Regis, thanks so much for joining us today. I really appreciate your insights.
No problem. I appreciate it. And you guys stay healthy. And the docs that are out there, hey, hang in there. I think it's going to get better and better days ahead. And there's going to be better things coming.
Thank you so much.
Thank you.